We have a lot to cover in today's Community Focus. Each month, we talk live with Dr. James McDonald, the Interim Health Director of the Rhode Island Department of Health.
Today, he joins us live via Zoom. Doctor, thanks so much for joining us.
Hey, Brian and Kim, happy Thursday. Great to be with you guys again.
Happy Thursday. So Dr. McDonald, come Monday, the statewide school mask mandate is being lifted. Some school departments, as we know, are opting to keep it in place. Also, the CDC is no longer requiring masks on school buses. So I'm curious, will the state implement that guidance as well?
Yeah, we're looking at it, and that's the direction we're heading in. And I think what you're really seeing is as the pandemic improves, the mitigation measures are changing. So some school districts are moving in that direction. Others are saying, we're going to wait and see. And, I think it's really a reflection of like, hey, we're kind of landing the plane. We're heading in the right direction. And to me, it's a time of some optimism in Rhode Island. I'm pretty optimistic right now.
Can we expect that announcement on Monday, perhaps, Dr. M, that kids no longer have to wear their masks on school buses?
Well, I would think tomorrow when the governor does his press conference, you might hear more of that information, because that's the type of thing that I think you're going to hear tomorrow.
Excellent news. Of course, we'll be carrying that on WPRI.com tomorrow. On the topic of masks, we're starting to see some notices from individual daycare facilities about mask requirements changing. To alleviate some of the confusion that's coming into our newsroom, who at this point is making the decisions about mask requirements for daycares? What should parents expect there?
Yeah, and keep in mind, we use the word requirement, but really we're moving towards the word recommendation now. And because recommendation has an optional quality to it as well, right? So what we're telling people in daycare is, since those children can't be vaccinated, we recommend masking still if they're, in daycare, in that environment. And that's something you're going to hear more about tomorrow as well. Keep in mind, we all want that vaccine for kids under 5. I was on a call nationally with some of the, manufacturers. It doesn't look like that's coming anytime soon. Maybe mid 2022. We have to wait and see. That's kind of what I'm hearing is maybe, in this, June, July, August 2022. We'll have to wait and see if that vaccine comes available. And that obviously will change things in that population.
Dr. McDonald, the state recently rolled out some updated guidance on vaccination requirements for healthcare workers. Can you just set the record straight here? Does this mean that unvaccinated healthcare workers can now go back to their jobs?
Well, it depends if they're in a licensed facility or not. If you're in a licensed facility like a hospital, nursing home, nothing's really changed because keep in mind the federal requirement, the Center for Medicaid Medicare Services or CMS, that requirement is still in play. So that doesn't really change much for anyone who works in a hospital, a nursing home, or other licensed facility. But in a private practice, there might be a possibility where people can do that. But what we're telling people is if there's a bona fide exemption in this case, you really have to have the primary series, but if you're not up to date in a licensed facility, we're offering the N95, that high quality mask, that medical grade N95 as an option where people get up to date. Because really what we're trying to do is get as many healthcare workers up to date in the vaccine as possible. And the rationale is this: when you go to one of our hospitals or one of our nursing homes, you shouldn't have to worry about getting sick. You should have to just worry about getting better, because that's what we do in our nursing homes and our hospitals.
Dr. McDonald, this week marked the start of a 2-year pilot program for safe injection sites in Rhode Island. They're also known as harm reduction centers. These have been used in other countries. It's a first for the United States. So what launched this week was the application period. What should the public know about where and when these sites could start operating?
Yeah, so we're excited about this. We're really glad we got the regulations done. Now, keep in mind, any place that's going to have this done has to get city or town approval. So it's a very transparent process that'll be done with the city or town. And I know the people who are thinking about doing this are getting their applications together and work with the cities and towns first. And where they will go is going to be public. And really think of it this way. We really want people who have this terrible disease, opioid use disorder, to feel safe, welcome, and really get a place where they can use safely so we can help encourage them into treatment. What we're trying to do is help people go into treatment. That's what you see with places like this across the planet is it helps decrease deaths and move people into treatment. And that's really the strength of a harm reduction center. It's an exciting time for Rhode Island because we really need something to help our people in this area. The numbers are just getting worse each year. So we really need a different strategy. And I'm excited about this possibility.
And Dr. M, just quickly before we let you go, we've got about 30 seconds left. We've been reporting in the last few weeks about the Care New England and Lifespan merger falling through. As the head of the Department of Health right now, you would have had to sign off on that deal as well. So any reaction to the fact that the AG pulled the plug on this one? Are you concerned about the future of Rhode Island's hospital systems?
Yeah, so we have really good hospitals in our state, and I'd like them to stay that way. And I think what I'm going to do is do what I can do to make sure they stay strong. One of the things the Attorney General pointed out was the Medicaid rates are low in our state. They're very low. He made that point really clear. And that's something that, quite frankly, we all as a state need to look at is why is that the case? And is there anything we can do about that? I'm interested in keeping our hospitals strong because I need them, and you all need them too. We all need to make sure they're strong.
All right, Dr. James McDonald, the Interim Director of the Rhode Island Department of Health. Thank you so much for your time today.
Thanks, guys. Have a good Thursday.